Another doctor leaves the Tucson VA feeling overloaded. A serious issue, he says, that puts veterans' care at risk. And tonight, he speaks out for the first time. Good evening, and thanks for joining us. I'm Guy Ashley.
I'm Whitney Clark in for Stella. The VA's second in command in Tucson today to examine the severe wait time issues. Deputy Secretary Sloan Gibson met with VA leadership, staff, and veterans groups to discuss access to care.
The visit follows KGUN 9's nearly year-long investigation that exposed serious wait times for veterans because of years of deceptive practices and mismanagement. Whistleblower claims that a government probe confirmed. Here is 9 on Your Side investigative reporter Valerie Cavazos.
For Dr. William Reese, caring for veterans is a calling. It's in his blood, he says. But this primary care physician is just weeks away from leaving the Tucson VA. He's already submitted his resignation a few weeks back.
I have had several emails asking for help personally, saying I'm overwhelmed.
He says many of his colleagues and nurse practitioners are drowning and continuously struggle to come up for air.
In the sense they can't keep up with the patients they have because of the complexities and medical problems, because most of them are pretty sick.
Dr. Reese has a packed panel of 1,200 patients with highly complex problems that take more time to diagnose and treat. But he says he spends too much of his time examining electronic view alerts that are pegged to patients' health records.
200, 300 a day, and they could take me 8 hours. I could do nothing but that and not see patients. And they're overwhelming, and it's dangerous because it could be a lung nodule, it could be a cancer from an X-ray report or a CT scan or an MRI. And I can tell you that some of the physicians I know get so overwhelmed they don't do them. They get so far behind and just go on.
So patients' health is at risk?
Oh, I think there's no doubt in my mind.
Overworked and overloaded, Dr. Reese attributes the high workload to the high turnover rate of primary care physicians at the Tucson VA. And when doctors leave, their patients can show up on his panel unexpectedly. Those unassigned new patients are added to his responsibilities. He calls them ghost patients.
There's all of these ghost patients that all of a sudden they'll show up and you get labs on a patient and you're like, who are they? I've never seen them. You know, and people drop off your panel and then you assign another 100.
He says it's chaos and appointments for regular patients are pushed back.
And they'll say, oh, we don't have anything available for 60 or 90 days. I hear that every day. I mean, all day long. I had a guy come in last week and said he waited 9 months to see me.
And you have no control over that?
Oh, I have no control over that.
Dr. Reese says he's gone to management many times about his concerns.
Yeah, I've definitely made it aware to management.
And their response?
I've never gotten a response.
Not a response at all? No explanation?
No.
Feeling frustrated and defeated, he's leaving the VA and going back to civilian practice because he hasn't seen any improvements.
My reasons for coming forward is certainly not to get anyone in trouble per se, but I think that this is a problem that has not changed in 3 years, and if change has to be made and people have to, lose their job, then that's how it is in the private world, and that's how it should be here.
Patient health is at risk. Some.
Absolutely.
I addressed Dr. Reese's frustrations and concerns with VA Deputy Secretary Sloan Gibson in Tucson to examine the access issues.
I can't talk to the specifics there, but I can say what we're talking about here is the maturation of the patient-aligned care team model.
But this particular doctor is overwhelmed, he's overworked. He went to management and got no answers. They did not address his concerns, which is why he's leaving. And that's the issue then.
I'd love for the doctor to call me or send me an email. I think every veteran in America knows what my email address is, sloan.gibson@va.gov. Send me a note. I'd love to talk to the guy. I'd love to find out specifically what his issues are. And with the primary care provider today, I said, part of what we need to do is we need to learn from you guys.
While Gibson touted the progress made at the Tucson VA, he acknowledged the need for more oversight in patient scheduling.
I am absolutely positively convinced that we still have inconsistent scheduling practices around the enterprise. I will tell you all, The number two mistake I have made in the 2 years and 10 months that I've been at VA is I did not require VHA to do mandatory, standardized, face-to-face training for every scheduling assistant in the enterprise. I didn't require it 2 years ago. I'm requiring it now.
And if there's substantial evidence of deceptive practices, he says,
We will remove, period.
Valerie Cavazos, KGUN 9 on your side.
Gibson praised the leadership for improvements in some areas, such as mental health, but he says his first goal is to find a permanent medical center director and chief of staff.